Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers introductory concepts in epidemiology and evidence-based practice. By the end of this lesson, you should be able to define epidemiology and describe how it has developed over time. You should be able to describe the essential elements of epidemiology and an epidemiological approach. You should be able to discuss the steps in the process of epidemiology. You should be able to explain the basic epidemiological principles such as population at risk, what a natural history of disease means, levels of prevention, host, agent, environment, relationships, and understand the web of causation model. You should be able to differentiate between descriptive and analytic epidemiology. You should be able to explain how nurses use epidemiology in community health practice and how evidence-based practice is understood. You should understand the history of evidence-based practice in healthcare and assess the relationship between evidence-based practice and the practice of nursing in the community. You should provide examples of what evidence-based practice is, and you should identify barriers to evidence-based practice. And you should also be able to identify resources for evidence-based practice. What is epidemiology? Epidemiology is the study of the distribution and determinants of health-related events in human populations and the application of that knowledge to improve health of communities and people. Epidemiology is a multidisciplinary science and it stands out on its own that recognizes the complex interrelationships of factors that influence disease and health at both the individual, community, and system level. It provides the basic tools for study of health and disease in communities. Epidemiology refers not only to infectious epidemics, but also to other health related events. So when you think of epidemiology, don't just think about infectious diseases. Think about anything that alters health in populations. RNs need to be aware that epidemiological methods are used to describe health and disease and to investigate factors that promote health or influence the risk or distribution of a disease. This knowledge can be useful in planning and evaluating programs, policies, and services in clinical decision making for nurses in the community. Basic epidemiological concepts include the interrelationship between an agent, host, and the environment. Please note that the relationship between a host, an agent, and an environment is called the epidemiological triangle. The interactions and factors, exposures, and characteristics of a causal web affect the risk of disease and the levels of prevention corresponding to stages in natural history of a disease. And that you may hear as web of causation. Let us now quickly outline levels of prevention in epidemiology. We have primary prevention, secondary prevention, and tertiary prevention. Primary prevention involves interventions to reduce the incidence of disease by promoting health and preventing disease processes from developing. Remember that secondary prevention includes programs such as screening designed to detect diseases in the early stages before signs and symptoms are clinically evident to intervene with early diagnosis and treatment. Tertiary prevention provides treatment and other interventions directed towards persons with clinically apparent disease, with the aim of lessening the course of the disease or reducing the disability and rehabilitating the client from the disease. nurses need to be aware of the fact that epidemiological methods are also used in planning and design of screening, which is secondary prevention, and community health intervention, which is primary prevention, and strategies in the evaluation of their effectiveness. Basic epidemiological methods include the use of existing data sources to study health outcomes and related factors, and the use of comparison groups to assess the association between exposures or characteristics and health outcomes. Epidemiologists are use rates and proportions to quantify levels of morbidity and mortality. Prevalence proportions provide us a picture of the level of existing cases in a population at a given time, and incident rates and proportions measure the rate of new case development in a population and provide an estimate of the risk of that disease. Let us now briefly touch on descriptive epidemiological studies and analytic epidemiological studies. Descriptive epidemiological studies provide information on the distribution of the disease and health states according to personal characteristics, geographical region, and time. This knowledge enables us as practitioners to target programs and allocate resources more effectively and provides us a basis for further study. Analytic epidemiological studies investigate associations between exposures or characteristics and health or disease outcomes with the goal of understanding the etiology of the disease. We're trying to find out where this disease is coming from. Analytic studies provide the foundation for understanding disease causality, what causes a disease, and for the development of effective intervention strategies aimed at primary prevention, secondary prevention, and tertiary prevention. Analytic epidemiology looks at the etiology or the origins of the disease and its causes, which is different from descriptive epidemiology, which gives us the distribution of the disease and health states according to personal characteristics in geographical region and the time it's impacting people. Let us now briefly talk about evidence-based practice. Evidence-based practice is not just a newest buzzword in town. Evidence-based practice was developed in other countries before its use in the US. Application of evidence-based practice in relation to clinical decision making in population-centered nursing concentrates on interventions and strategies geared to communities and populations rather than individuals. But you can have evidence-based practice that is concentrating on individuals, especially in your practice as a nurse. The goals, as evidenced through Healthy People 2020, are to increase the quality in years of healthy life and to eliminate the health disparities in populations. Okay, cost and quality of care are issues of evidence-based practice. We're trying to figure out the best way, the least costly way, and the most quality way of providing care not only to individuals but to also to populations, not only in the US but globally. Evidence-based practice includes interventions based on theory. So we want to be, nurses need to be aware of the role of theory in evidence practice based practice. We also want to pay attention to expert opinions through journals, and we want to have knowledge of provider knowledge and research. And we're talking about quality research. Thank you for listening to this lesson. I hope you have enjoyed this overview of epidemiology and evidence-based practice as it relates to nurses. For questions about this lesson or the assigned chapters or corresponding notes, please feel free to email me. Have a lovely day.